So I'm here with Dr. Phil Liefman from the Bayside Skin Cancer and Medical Clinic, speaking to him about Skin Cancer Awareness Month and the importance of prevention, but also getting checked. Phil, do you have any tips, tricks for our audience today as to what they should be looking out for and what they should do to firstly try and prevent this from happening, and secondly, if they suspect something, what they should do as well?
Yes.
Good.
So first of all, we want to try and not be sunburned. That's probably the crux of the matter. Sunburns in the first 10 years of life being the most important, the most damaging. The disease is predominantly, talking about melanoma in particular, the disease is predominantly genetic, and then it becomes more a question of early detection rather than prevention. As I said, unfortunately, we have the highest rate of this in Australasia in the world. 1 in 14 Australian males will get a melanoma, 1 in 23 Australian females. It causes 1% of deaths in Australia, the commonest cause between the age of 15 and 45. Not that it gets less common, then it's just that we start to get prostate cancer, women get breast cancer, and we both get lung and bowel cancer. All of the diseases cause more than 1% of deaths. So we recommend annual skin checks. We look at people's skin and look for things that we think shouldn't be there. And we also recommend the patients self-check themselves. We ask patients to be thorough and going from the tops of their heads to the bottoms of their feet. It's a bit hard to do your hair, but I think when you go to the hairdresser, it's an easy enough question to ask a hairdresser, is there anything on my head? We had a really big one in this practice in 2010. And I reckon this woman's hairdresser would have seen it for a couple of years, but not commented. We don't say to people, that's a really big mole you've got on you. And then after we've done our head, looking behind the ears, looking at the face, upper limbs, lower limbs, front and then back. I reckon we know our hands pretty well, so anything that's new on the hands, so bring it. But formally run your eye from your wrist to your elbow, so 4 or 5 times, just scanning up and down, looking for anything that's changed or any mole that's new. We think that about a third of melanomas come in moles that change. So if you've got a mole that's been there your whole life, but it suddenly feels different in that it hurts or it itches, it's behaving differently in that it's bleeding or it's ulcerated, and obviously any mole that's grown, I think that's worth checking out. 2 out of 3 come out of the blue. So after you've done your forearm, we suggest you do your arm next. So again, running your eye from your elbow to your shoulder. You'll need a mirror to see around here. When you've done one upper limb, do the other. When you've done both, we do our lower limbs. So we need to look at the bottom of our feet. We get 2% of melanomas in white people are what we call acral melanomas. Acral melanomas are melanomas that we find on the palms, the soles, or on the nail apparatus. So if you've got something on your nail and you haven't hit it with a hammer, you haven't jammed it in the car door, bring it. Most marks we get on nails are fungal infections, but we'll get them on more than one nail. But if it's on a solitary nail that's brown, it often involves the cuticle, which is this bit of skin around here. It's worth having a look at. So when we look at our feet, we need to look at the bottom of our feet. We need to look at the top of our feet, search between our toes. After we've done our feet, legs next. So between knee and ankle is the commonest site that females get melanoma.
Between the knee
and the ankle.
Right.
Yeah. So you look at the inside, the front, the outside and the back, thighs next, inside, front, outside and back. Stand in front of the mirror, look at our chest, abdomen, look at our pelvic region. We do get melanomas in areas of the skin that have never seen the sun. So when you self-check, we need to be thorough every month or two and look at all our skin. And then you need a handheld mirror that we can turn our back to our bathroom mirror, look across our upper and middle back, which is the commonest site that blokes get melanoma.
Right.
Squat, look up at your butt, we get a better view in life. But we had a really big one in this practice in 2009 off a guy's bum. With blokes are often a bit loath to self-check. We do know that women find 38% of males' melanomas, blokes find 2% of women's melanomas. So right. we need the females to do themselves.
And Phil, what are we looking for? Is there a particular appearance of a melanoma, or is there some sort of commonality that we should be checking out?
Anything that you don't like. So sometimes we have these gut feelings in medicine, and I think if you've got a gut feeling you don't like something, I think it's worth getting it seen. As I said, any mole that's changed, so it's been stable for many years and then it's suddenly altered. And
Or if there's a mole there that hasn't been there before? Or
after the age of 40, if a mole's new. They talk about the ABC too, the A standing for asymmetry, and that if you reflect it along a vertical or horizontal axis, it's not the same. And it's being asymmetrical because B, the border's irregular, and C, multiple colours. As the tumour grows in depth, it changes colour.
Okay.
Okay. There's a couple of tricks to this too. We have these things called amelanotic melanomas. Melanocytes make pigment, and that's why melanomas are typically brown or black, but 5% of these tumours are so bizarre they don't do that, and that's why we can have, this is just Googled amelanotic melanomas, Brett, but we can have pink melanomas and red melanomas and skin melanomas, skin-coloured melanomas, or melanomas that look like scars. So if you find a mark on you, just be a little bit careful. The way that I tell patients to remember these is to think of two things. One's the ugly duckling and two's 3 weeks. So why the ugly duckling? In the fairy tale we had one swan. And if you ever get an amelanotic melanoma, you'll get one of them. You won't get 2 or 3 of them. So if you find 3 marks behind your leg that look the same, there'll be bites or a rash. But if it's solitary, if it's an ugly duckling, then be a little careful, because if you look at it and think this is a pimple, it's a mosquito bite, it's trauma, any inflammatory condition gets better in 3 weeks.
Yes.
So that's where the 3-week rule kicks in.
Sure.
So I think if it's solitary and it's persisting and it's there for more than 3 weeks, you want to think a little bit, is there any possibility this could be an amelanotic melanoma? They're rare, these things. As I said, they form 5% of melanomas, but do cause about 20% of deaths. About half these are fatal. They're picked late by patients, and we need to be a little bit careful with them. So
bottom line is, though, get checked annually.
I think it's worth getting checked annually, taking into account there are some racial variations. So you know that full Asians or Hispanics get a 30th the rate.
Right.
People from India or Africa get a 50th the rate. So it's really people with blue eyes, red hair.
Guilty as charged.
You need to be a little bit careful. You know, if you burn easily in the sun, you're more likely to get it. But yet no one's off the hook. We know Bob Marley died from a melanoma.
The late great Bob Marley, really?
The late great Bob Marley, yeah.
Wow. Yeah. All very fascinating, but the other thing that I think would be worthwhile mentioning is it's not just that annual checkup. If there is something suspect, get it checked.
Don't wait.
Don't wait.
Yeah. Look, I guess most of this talks about melanoma. Really, most of what we do in this clinic is remove basal cell carcinomas and squamous cell carcinomas. And these will often present as a lump that's growing. They can grow in a few weeks to a few months. But I think anything that's new on your skin, if it's there for more than a few weeks, it's easy enough to get it checked.
Are there any good resources or websites that people can go to? I know you've been using Google here, but it's not always, Dr. Google is not always the best way to find out about things, but are there any...
So the Bayside Skin Cancer Medical Clinic has its own website. There's a bit of data there. There's the Skin Cancer Foundation, the Australian Cancer Council. There's a lot of stuff on the web now. Yeah, so you can Google skin self-examination, appearance of melanomas. There's a lot there.
Yeah. And when in doubt, speak to the medical professional.
I think that's the thing. Yeah. When in doubt, speak up. And I guess the other thing is, if you're ever in doubt after speaking to the medical profession, get another opinion.
Yes, as opposed to going back to Dr. Google.
I guess so.
Yeah, very good. Right, yeah. Fantastic. Thanks for the opportunity to join us today, and for your time specifically in this Skin Cancer Awareness Month. As the local state member of Parliament, it's my job to not only help local community members, but also to help inform them about different things. And Skin Cancer Awareness Month was a wonderful opportunity to have a short chat with you about these very important matters that affect our community.
But if I just can add one thing,
of course,
to leave it on a positive note.
Please.
Melanoma always begins in an area of the skin where there's no blood vessels. Oh. So when we pull them off and they're called level 1 melanomas, we promise these patients that they're cured. We can't do that with many other tumours at all. So we've got a chance to cure all these. We just have to find them early enough.
Very good. A good note to finish on.
Thanks
so much.
Thanks, Brett.
Terrific, Dr. Phil.